Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have none other than Dr. Parimala Devi, who is a very famous, popular gynecologist, obstetrician, and past president of Gynecobi Society. And she is the Guinness World Record holder in screening the cervical cancer. And apart from that, she is a colpologist as well as a robotic surgeon. But today she is going to talk about to bring the awareness about the breast cancer. There was a time when all our mothers used to feed their own breast milk without having any bottle or nipple put in the child's mouth. And if mothers are not available, the aunties or the people around, they used to feed the baby, or even the grandmothers used to feed the baby. It's so much so that they never used to put any artificial nipple or bottle in the mouth of the baby, and the babies used to be very healthy. Mothers used to feed till 2 years, 3 years until they got another one. Because the reason is when they're feeding, they will have no pregnancy, they will not conceive.
Yes.
Amenorrhea
Yes.
will be there. And that was
Contraception.
their idea. But today, the breast cancer has increased, and now we have Parimala Devi to explain about that. Welcome, Dr. Parimala.
Namaste, madam. Good morning. And I'm very happy to speak about the subject of breast cancer, even though there are a lot of media information. Every time there is something or the other which is going on. In August, we are observing breast cancer awareness or breastfeeding awareness month, actually, more than the cancer awareness. Why this breastfeeding awareness also is so important is going to tell that breast cancer comes down with breastfeeding. That is the one. But why so much of breast cancer is increasing, especially in young women? Before we used to study, when we were studying in some 90s, 2000, at that time in the textbook or wherever we were seeing, hardly we used to see any breast cancer. It was only cervical cancer or other cancers you would see, and blood cancers like this. But now the breast cancer has increased from 20, 22 years.
It has become number one.
Number one in the statistical order. If you place the statistical order of the survey, the cancers, one is breast cancer, number one. Second is cervical cancer. Third is oral. Like that, it goes on intestinal, ovarian in our women. Why this is increasing so much? It is a real matter. Like we all have to, the scientific people like you and me have to
really
bring
worry
the
and think
attention of
about
the
it,
people.
concern about it.
Yes,
Yes.
because as we are progressing in our technological thing and in our job opportunities and everything, women are also career oriented. There's nothing wrong. Usually everybody wants to have the education, and then they want to be economically independent. Then they want to think about the marriage, because the marriage institution, the principles also have changed now. And when they get into this one, they are already into 30, 35. A woman, actually menstruation age is something very different. She starts menarche around 12 to 14 years, then she will end up by something 50 years. This is natural, which is not any scientific, which is already biologically determined. But when there is so much of estrogen activity starts, the another activity which should go on is ovulation. Along with ovulation, there should be pregnancy. But what is happening now, because of this education, because of that empowering nature, many of the women, they are taking the marriage as the last part. And if they get married, also getting the baby. If they get the baby, also feeding the baby has become
They
a
don't feed the
questionable thing.
baby. And I have seen
Question,
in the
yes.
airport, the Aya is pushing the pram and she is feeding with the bottle. And the mother who
Bottle.
has become so
Yes,
obese,
yes.
she is
So
walking
this
around.
part, this
So they are
problem
not
is,
even bothered about feeding their own
yes,
babies.
obese.
Yes.
Yes. So our women should understand that by getting married at the right time and delivering the babies, their estrogen activity, unopposed estrogen activity will come down. So what happens if they don't get into pregnancy or not breastfeeding? The unopposed estrogen activity, we should be counteracted by the progesterone, the hormone which starts surging in pregnancy, and after the delivery, in the lactation, there will be no protection for them to go against this estrogen unopposed activity. That time the breast cells are not mature. They are more towards the carcinogenic changes. So when the cell changes gets more mutated, then there will be lot of chances of they developing these tumors. So once the tumor activity starts, it's very difficult to control. So that carcinogenic activity will be controlled usually by pregnancy and also by the breastfeeding. And also again, it is not only one baby, like when they are getting the baby around 30 plus, if they again in the interval between the another baby is something like 7 years, 8 years, again there is the unopposed estrogen activity. We are not telling just you deliver and give the baby milk, that only will protect, but you balance it. So from that, the estrogen activity can be controlled. And if at all there is any something like they are feeling in the breast, when they are about to have the bath, when they are not with the clothes, then their naked breast, they can examine. Self-examination is one all should know, all women should know, because from 20 years only they can start this self-examination of the breast on both sides with their own hands. From the part of the hand like this, they can feel the 4 quadrants of the breast, left, right, and above and down, and also the nipple area from the thenar eminence, so that they can make out is there any small tumor or some hard thing is coming. Many people come. Actually, 60% of the breast cancers can be prevented by self-examination. So self-examination of the breast, one thing our women have to be aware, and delivering the babies at the right time so that they will get a lot of protection. And doesn't this lactation hormone don't have any protection? Yes, it has protection against this breast cancer. And another thing what our women should really enjoy is their tone of the muscle, abdominal toning happens whenever they are feeding the baby.
And their weight also comes down.
Weight also comes down. So, so they should think that it is not their whatever like mummy makeup surgeries or some other lipolysis or anything will be helping them. Just it is there in their own hand by feeding the baby.
And apart from that, when they hold the baby and feed, they have the oxytocin and the feel-good hormones released, and that makes them very happy.
Yeah. Happy.
So the happiness
will be happy.
hormones are also increased. Yes.
So happy hormone is really helping their mental health, and also their body toning and body shape is more maintained. So, and they think that by wearing some costly bras or anything, by this one we are going to prevent the breast cancer. It is not so. It's a myth actually. That is not going to give you breast cancer or anything. So maintain your lifestyle and deliver at the right time. Feed your baby. You can feed as much as possible how your this one time permits. But when you take out the milk and store it and go, that time, but the nipple stimulation is not there for the baby. So when there is no stimulation, there is no protection, there is no happy hormone released also. So you may give your breast milk. You may think, oh, I'm giving my milk, I'm putting it in the breast milk bank and going. No, but that is not going to help. Baby will get the milk. No wonder, we appreciate you. But the very reflex which should happen from the hypothalamus to the breast tissue and to the uterus, toning of the abdomen muscles, the fat burning. Fat burning also has been reported. Nearly about 30 to 40 calories are spent in one breastfeeding, as the statistics says. So all these advantages they should take, and they have to see that they will be usually giving very much importance for their time to feed the breast milk for the baby. During the pregnancy only, most of our good obstetrician will teach them how to take care of the nipple, because nipple will be many times retracted in the breast, that they have to pull it out when they are having birth, because that time breast will be soft. With some moisturizing or Vaseline cream, they can pull out the nipple and they can get prepared themselves for the breastfeeding. So by doing the breastfeeding, there are a lot of advantages. As August is approaching and we are observing breastfeeding week, some scientific knowledge people like you experts will definitely highlight the society about all these things. And we have to make our women, if at all you have something, when you do the self-examination in the breast on both sides, something is not natural, immediately contact the doctor. There may be some retracted nipple at over 45, 50 years in those menopausal age group. It is not normal. There may be some discharge. There may be some pain in the breast all the time. There may be asymmetry of the breast size suddenly after 40, 45 years or less also. Please be aware of the breast cancer. Because if you diagnose it early, if you come to the doctor early, you can really live to your full life expectancy.
You can be cured of it. Yes. And now
Sure.
they have the surgery to have almost the cosmetic, no?
Yes.
Normally
Yes.
looking.
Cosmetic surgeries
And
also.
Parimala, what about the men?
Yes. Men also, we may think like, oh, breast cancer is only, we are cursed. Women are only cursed because of this we are getting. It's not so. Even men have breast cancer. That's 1%. But that 1% is very pathognomonic, very aggressive cancer they get with lot of metastasis very early, ductal carcinoma. So men also have to be very much aware about this one. Men, family, and especially our women, we would like to plead to them, please be aware. Just take care of your self-examination every month or every at least 2 months, at least 3-4 times in a year, and just be aware about your hereditary factors, whether your mother or aunt or somebody had cancers in the family, especially breast cancer. Try to protect yourself by taking care of yourself. Be healthy, be happy.
Yeah, thank you so much, Parimala Devi. In other words, you are telling old is gold. Whatever our mothers,
Yes.
grandmothers, great
Yes.
grandmothers, they followed, that is the best one. And you aping at the best and giving the feeding bottle and the nipple in the mouth of the baby is going to make baby sick as well as you get the cancer. So that has to be remembered.
Yes.
So if you
Yes.
feed your baby, you'll be very happy, you'll be very healthy, and you can say bye-bye and keep the cancer away. But if you don't get married in time, have the baby in time, feed the baby in time, you are inviting the cancer. So that's what you're telling, isn't it? Yes.
Thank you,
so
madam.
much.
Thank you.
Thank you.
That's the way.